me now is Michel Attalah, General Manager of Siemens Healthineers in Saudi Arabia. Thank you so much for joining me here now.
Thank you for having me.
So Siemens Healthineers has put a big emphasis on digital medicine in Saudi Arabia. Can you tell me a little bit more about that?
Yes, I mean, sure. First of all, digitalization in healthcare is a global trend, especially since the pandemic, because people realized more and more that care does not have to be delivered in person. Telemedicine, remote monitoring, wearables are now almost a daily part of daily life. In Saudi particularly, and I'm sure you know this, the society in Saudi is extremely digitalized already. All government procedures, medical records, everything is already digitalized. And there is actually a very ripe market for this digitalization. What we are doing specifically is a couple of things. First of all, we are bringing our know-how that we have built up in Europe and the US, mainly in digital health, for example, in electronic patient records, for example, in state-of-the-art archiving of all kinds of patient diagnostics, images, photos, videos, and so on, where we are bringing our know-how in this, and there are some projects ongoing in that field. Secondly, and is also very important, part of the transformation in Saudi Arabia means that these technologies are introduced, but they're not necessarily introduced using a traditional business model of I invest, the government, I mean the customer or the client invests, purchases the technology. We are doing it actually as a PPP approach in some cases, meaning that we come in, we build this infrastructure, we install the software, we train the people, and then we are compensated over the lifetime of the project, 5 years, 10 years, as a kind of a partner for the Saudi government. And that's mainly what we're doing in this field.
So is that the scope that you see for public-private partnerships, or is there more?
There's much more. There is actually a very big transformation program in Saudi healthcare, driven by the Ministry of Health. The whole sector is transforming, where the private sector is expected to take a much bigger role. And PPP in digitalization is one aspect. I mentioned it because it's a relatively innovative. There's usually not that many PPP projects in IT or in healthcare IT. There's also very large PPP projects in building new hospitals, in renovating hospitals, in some cases in operating some hospitals or parts of hospitals, where companies like us would not only sell technology, but we also would bring our know-how, our resources to operate the machines, so that the customer, meaning in this case the MOH, can focus on their job, which is to deliver the care to the patient, and not necessarily be involved in running machines and installing and investing.
So what would you say from your point of view is the biggest challenge that you face in Saudi Arabia?
There are many challenges in Saudi Arabia. One of the big challenges is what I said earlier, is the size. It's a very, very large, complex country and society, where you have over 300 government hospitals, another 150 private hospitals, and transforming this at this scale, because these projects I mentioned are happening on a country level. So one of the main challenges is transforming a region or a city is relatively easy, but when you're trying to do it on a country level with over 30 million inhabitants, like I said, with a lot of legacy, with big ministries behind, the complexity of this project is very high, and that's of course makes it very challenging. Yeah.
Thank you very much, Michel Attalah, Siemens Healthineers in Saudi Arabia. Thank you for being with us.